You're tuning into McLaren Port Huron Today's Health. And I'm at McLaren Port Huron Emergency Center speaking with Dr. Michael Paul in regards to stroke awareness and treatment. Thanks for being with us, Dr. Paul.
You're welcome.
Could you tell us, if a person is having a stroke, how important is that time for their survival and outcome between when they're having symptoms of stroke and when they get treatment, and why is that time so important?
Well, it's very, very important for them to get help as soon as possible. We have a dictum that we always use. It's called time is brain. For every hour that somebody is not treated medically with a stroke, and it usually adds about 3.5 years or more to the aging process of the brain. So it's very important to get medical help as soon as possible and to try and get this resolved as soon as possible.
What are some stroke symptoms?
Well, one of the basic things that we tell people to look out for is asymmetry of the face, which is facial droop or slurred speech, or the inability to raise one arm or the other arm, or numbness to one of the arms or legs. And then slurred speech is probably the key one, though, that we really look for.
What are some critical things, if you're witnessing somebody having these symptoms, that they should do?
Immediately, as soon as possible, call 911. You need to get the patient to the hospital so they can get rapid assessment. We treat these nowadays as what we call a priority one. Mm-hmm. It's very important to get them treated as quickly as possible and get them assessed as soon as possible.
Why is it so important to call 911 and have EMS transport someone to the hospital as opposed to them driving themselves or somebody else driving them?
Well, with a stroke, there's two types of strokes. One is a hemorrhagic stroke, which is actually bleeding in the brain. This occurs perhaps 90% or 10% of the time. And there's ischemic strokes, which is the ones that we can actually help people with, which is about 90% of the time. But as a stroke is an evolution, as it progresses, they can get all kinds of other symptoms, which can be life-threatening.
Okay. If someone's to arrive at McLaren Port Huron Emergency Center with stroke symptoms, what's the first thing that happens to them? How are they treated initially?
Well, if they come by ambulance, they're brought right back to a bay and placed on a stretcher, and we immediately start assessment. We have multiple things that happen all at once, but we try to get them assessed, get a CAT scan done as soon as possible, get the appropriate lab work, discuss the findings with patient and family, and try to get everything resolved as quickly as possible.
Is TPA used for stroke patients?
TPA, tissue plasminogen activating factor, is used in a subset of patients. Not everyone qualifies for this. There's many restrictive criteria to it, but it is a common drug that we use. It's basically called the clot busting drug.
Okay. What kind of follow-up is used for stroke patients? What do they usually get after they've been treated for a stroke?
Well, if they've been treated with TPA, we transfer them to a tertiary care facility because they need a higher level of care and monitoring than what we can provide in town at this time. Mm-hmm. If they don't get TPA, they're admitted to the hospital. They get further evaluation, further testing, neurological assessment, and depending on what they find and what is needed, they may get rehabilitation services afterward.
Okay. Dr. Paul, thanks so much for joining us today and sharing all this information. Do you have any closing comments?
Absolutely. As we said, time is brain. It is very important, if anybody demonstrates the symptoms that we talked about, that they seek medical help as soon as possible.
Stay tuned. We're going to take a quick break now and go back to the studio.